Welcome to a brand new edition of Skin Sense. I'm your host, Jeannine Mazurkiwecz, and we're back with Dr. Steve Schleicher. And today we're talking about laser and laser removal of some items like tattoos and rosacea, but we are focusing our attention on the laser machine today.
Right, and today we're going to first talk about rosacea, which is a very, very common condition that affects the face. Okay, and it's characterized by these dilated red blood vessels. Some people can get pimples with them as well. And we have Tara here, who is gracious enough to allow us to demonstrate how well the laser works. And we have Ray here. Ray works for the laser company that's actually present here. And basically, Tara, you had the laser about 8 years ago.
Yeah.
Okay, and it worked well back then. And it's just that over time, blood vessels can reform. Rosacea isn't a serious condition, but it just doesn't look good because, you know, you have a red face. And there's certain things that can make rosacea worse. Stress can make it worse. Alcohol can make it worse. Temperature changes can make it worse. But by and large, it's just a hereditary predisposition to getting this condition. I don't know if anybody, Tara, in your family.
My mom.
Yeah, exactly. And you know, we see that all the time. It just runs in families. When you're fair-skinned, you blue eyes and whatever, blonde or red hair, you're much more prone. Yeah, exactly. Yeah. She's classic to getting rosacea. Any trigger factors that you know about?
Temperature changes, alcohol. Sometimes it'll just come on for no reason too.
Yeah. Yeah, and it's almost like exaggerated flushing, but unfortunately the blood vessels just stay there. So you have these red blood vessels, and again, it's not a serious condition, but it just doesn't look good. And fortunately with lasers, it's very, very easy to get rid of these blood vessels. And Ray, maybe you can even talk about what the laser does to get rid of the blood vessels.
Essentially, we set the laser so that it is able to pick up the blood vessel, so the blood vessel actually absorbs the energy from the laser, so that it collapses the blood vessel and removes the blood supply to the vessel.
Okay, so before we do the procedure on the rosacea, again, talking about what the laser can be performed for other than just rosacea patients.
Well, it can be performed for a lot of entities. For instance, we'll show a tattoo removal, which is commonly done by laser, which is one of the best treatments for the tattoo. And for some tattoos, it's the only treatment that's really feasible. This day and age, I've heard some figures like 20% of the population has at least one tattoo. So, which is great, except, you know, a lot of times you don't want your tattoos anymore. I heard an interesting case from Ray. Someone had some female's name tattooed on their genitalia, and they broke up. So what are you going to do? Okay, you're not going to do any cutting.
Save my comments for a different show or for during the break.
It happens, and we see things like that, and that's one of the best ways, or the best way, to get rid of many tattoos, depending on the color of the tattoo.
All right, so coming up, we're going to be talking about tattoo removal with the laser, and there are some colors that are actually harder to remove with the laser, depending on what kind of tattoo you have, but that's coming up later. If you're watching us, if you're just tuning in, you're watching Skin Sense, and we're talking about the removal of tattoos with laser and also rosacea and how it could benefit by getting this procedure done. Obviously, this has to be done by someone who is certified.
That is correct. Absolutely. Lasers are very powerful. Okay, and one of the things you have to realize is that when we do the actual procedure, you have to protect the eyes, because the eyes are very, very sensitive to laser light. So you'll see that we'll have goggles on, and you know, the patient will have actually eye protection, eye shields on. That's really, really, really important.
And what is Ray's job in this? As far as do you have to decide how strong the laser is?
I do the calibration of the machine.
Okay.
I review the guidelines and parameters for the treatment, and then consult with the physician in reference to what the patient's expectations and what the goals are for the physician to arrive at appropriate treatment parameters for this particular patient.
Okay, so you have already discussed what level of intensity the laser will be on. Correct?
Yeah, and the good thing is the laser for this particular procedure, it doesn't hurt. It's just flashes of light, okay? And really the only side effect you can get is some bruising.
Okay.
which is, you know, everybody knows bruising is temporary. By and large, the more bruising you get, the better the procedure is. But, you know, people don't want to have bruises for the most part, so we don't usually use that top setting.
Okay, so when we come back here on Skin Sense, we're actually going to be seeing the procedure done on rosacea, the laser procedure. So stay with us. Coming up later in the show, we're going to do that tattoo removal. Welcome back. You're watching Skin Sense seen on SSP TV. I'm your host, Jeannine Mazurkiwecz, and we're here with Dr. Schleicher. We're talking about laser procedures, and for our safety, we're going to be wearing these glasses to protect ourselves and our patient and our cameraman from the lasers.
Yes, which is very, very important. And again, we're going to be treating these little tiny blood vessels that you can see. By and large, they affect the cheeks. They can also affect the chin and the nose. So we usually do a little test area first, which I think we're ready to do. And the purpose of the test area is basically to help regulate the setting.
Okay.
If
We are on.
Okay, we're on, and then you're going to feel, or actually experience a little flash of light. And we look for basic filling of the blood vessels and how long it stays empty. So in this case, we can actually raise the setting up.
How you doing?
Good.
Okay. Does it hurt at all?
No, not at all.
Okay. Is it based on the kind of skin, like on a per patient basis, as far as?
Yeah, it's based on the kind of, and it's also based on the thickness of the actual blood vessels.
Okay.
Okay. And some people have these little, what's called cherry hemangiomas, little tiny groups of vessels that come to the surface, and that's a different setting. But for here, do that area, and we'll do that area, and we can probably go up a little bit more. Yeah, I would go up a little bit more.
So again, explaining what exactly that laser does when it goes into the skin. What is it doing?
Right. Well, the light is actually absorbed by the blood vessels. Okay, which is what we want to happen, and then you're in essence sealing off those blood vessels and making them go away. So it's a little bit different than, say, when we do a laser for tattoo.
Right.
Because for a tattoo, we want to pulverize the tattoo pigment, and that'll be upcoming. We'll show that. But then, once we have the right setting, it's very, very easy to do.
How many treatments does a patient usually need to see these results?
Well, Tara had a treatment 8 years ago.
Wow.
Okay, so, and she just recently experienced the vessels coming back to a greater degree. So.
How you doing?
Good.
I think it might look and sound a little bit hurtful, but as far as Tara says, it's no pain, right?
Yeah, no pain.
No pain.
What are you feeling? What does it feel like?
Kind
Probably
of
some
like.
flashes of light.
Yeah.
Okay.
So you can still see them, believe it or not, even though she has goggles on.
Right.
So, but it's a very, you can see it's a very, very simple procedure.
Can the laser be done on varicose veins?
Well, you know, that's a good question. 4 veins of the foot you can do the laser on, but unfortunately, it doesn't work that great. Okay, you're better off doing what's called sclerotherapy, where you actually inject the veins. Now, if you have tiny vessels, yeah, then you can do that.
So this laser is specifically for, like you're saying, tiny vessels are in the skin?
This is for tinier vessels, correct. It looks pretty good. I don't see, maybe a tiny little bit of the nose. We're all goggled. We'll do one little spot here, and the other side looks good, right? Yeah, she looks great. Chin, we do a little chin. She has a little bit coming out in the chin. So we'll just do the chin. But you can see there's no pain with this. It's a very, very simple procedure. And it works. It works tremendously.
Again, you talked about how the patient can help promote healthier skin by following those, keeping away from those trigger points where the alcohol could play a role, keeping your stress level down. So I'm sure that you follow some of that of why you've only been able to come back once every 8 years. That's terrific.
Well,
So
she's a pharmacist, so I'm sure stress level is pretty high. So.
no stress there. So now she might see some bruising, right? Just to reiterate.
Well, actually, she probably won't, because usually the bruising is pretty immediate. And what we tell patients is to be careful with the sun, okay, over the next few days, because it makes you a little more sensitive to sun. So you want, if we get sun around here, yeah, you want to use a high sunscreen of at least 30 to protect yourself. And other than that, she'll do great. She'll do great.
All right, well, coming up, have you decided to get a tattoo that you no longer want now? Maybe it was someone's name or a goofy symbol. Well, we're going to talk about getting rid of those tattoos right here on Skin Sense, so stay with us. You're watching Skin Sense here on SSP TV, and we're talking about those tattoo removals. We all know someone who's had a tattoo, they don't like it, they want it removed. Well, guess what? You can get it removed. And we're here with Katie, and our patient today is Danielle. So before we do the laser procedure, we're going to talk to Danielle a little bit about the tattoo that you don't like anymore. So.
Yes. Now I've had it for about 6 years, and I just don't. At that time in my life, I thought it was a good idea, and now I look back and like I don't want to be 80 and still have that tattoo. So.
Well, you do have other tattoos.
I do.
And you like those?
I like those.
Okay. So the tattoo that we'll be removing is on your
Left side.
Your chest?
On my left side.
On your
yes,
left side.
right there.
Okay. And it says live, love, learn.
Live,
right?
laugh, love.
Live, love. Okay. So same thing. So we're gonna get that going. How long will this procedure take?
Basically, the procedure is only going to take a couple minutes. We use a laser called the MedLight 2. It's basically a type of YAG laser that uses photoacoustic light, which causes a reaction in the pigment to spark, and then basically your body digests the dye from the tattoos. But most of the time it does take, they say, about 10 treatments before you see it completely gone. Some people can take more, some people can take less. It just depends on the type of the ink in the tattoo. Black inks are the ones that work the best. Then other colors like blues and greens don't come out so well with this type of laser. So there are other procedures like salibrations that you can do to get the ink out that's residual from the tattoo removal after the ink is gone.
Mm-hmm. So when did you make the decision that you wanted to get this removed?
Well, I always thought about it, and then having talked to Katie about it, I figured I was give it a try.
All
It
right.
can't be any worse than it already is.
Now, despite you wanting to get this tattoo removed, you also want more tattoos, right?
I may get like another one, but nothing crazy that big.
And Katie's thinking, don't.
I don't have any tattoos, so.
All right, well, let's get Dr. Schleicher in here, and we will show you at home what the tattoo removal looks like with this laser surgery that we are about to begin. All right, so now we are ready to show you the laser removal of a tattoo, right, with Danielle, and Katie is going to be performing the procedure on the Live, Laugh, Love tattoo here on the side of her body.
And we'll do one little test area just to show
This is how it's going to feel.
yeah, how it feels, and
Okay?
Yeah.
that's what it feels like. But you can see this
really
little whitish area here, okay? And that what we're doing again with the laser, we're actually pulverizing that pigment, and then over the time, it's actually the body that gets rid of these little tiny particles.
Okay, comfortable? Are you
So-
okay?
I'm okay.
All right.
And we
I'll
go
hold you
pretty
back.
fast, so but if we
All right.
get, we'll take breaks, and
Yeah, if you need a break, let me know.
Katie
right.
can start any end you want, and
Start up here.
we'll go.
Okay, now as she's doing that again, like, you have to usually get a couple of these procedures done on your tattoo, which we were discussing earlier, Doc. So when you're thinking about getting a tattoo, make sure it's something that you're really going to want, because the removal of it is probably more expensive than it is to actually get the tattoo in the first place.
And it does hurt a little bit getting it.
Now,
How are you doing there?
Okay.
If you want us to take a break, just say the word. We'll take a break.
All right,
if you wanna
maybe we
explain-
should take
Okay, we'll take a
for
break.
second.
okay.
So what does it feel like to you?
like little
Like rubber bands
like rubber bands.
slapping.
Rubber band slapping on the
Yeah.
side of you.
With a little
So-
bit of grease.
And we give the patients a little bit of a break. And this just happens to be a very large tattoo as far as tattoos go. Most people come in with little tiny things that they'd be done by now.
Yeah, and
So
basically, as you see, the laser only reacts where the areas with the dye from the tattoo. So around it, you see a little bit of redness, but you don't see the same kind of whiteness that you do with the reaction from the ink.
yeah, and
Okay.
then we'll just keep blasting you and
Ready?
Yes.
Okay. Deep breaths, deep breaths. So this tattoo is a little easier to do because it is a straight line. The more detailed the tattoo is, the harder it is.
Well, they get complicated. The good thing with this tattoo is it's all black. Okay,
Right.
there's certain colors such
Right.
as greens, aquamarines, certain shades of blue are very, very difficult to get out. Okay, even with the laser, reds and blacks do the best. But we can never predict how many treatments an individual will need. Some people, after 4 or 5 treatments,
Need a
it
break?
looks
Yeah.
great.
Okay. Now, would you say this is more pain, or would you say the tattoo itself was more pain?
No, this is a lot more pain.
Oh, okay. Really?
That's surprising.
This is more
Certain
painful.
spots though, like it, I feel like, I don't know.
Probably right over your ribs. And,
Yeah, like the last part that you just did was the worst.
yeah.
More sensitive areas.
But it's bearable. We don't hear any screams, so that's good.
No.
Yeah.
Not
Okay,
yet. That's
good.
we're on the commercial break.
Right, right. Okay.
All right?
Yeah, we're
Yeah.
ready.
Now, is there anything that the patient needs to do once this is all done? Like, what is the care for this? Because she's going to have a little bit of irritation today, I'm sure.
Right, and a patient can use ice right afterwards as a cooling effect. And then if there's any openings, we tell them to dress it with a little, something called Aquaphor, which is an over-the-counter moisturizer, and a little gauze. And that's basically all they have to do. If it's on an area that we're going to get sun exposure, you're probably better off using a sunscreen for at least a week or 2 after the procedure.
Give you a little break.
Yeah, it's funny.
And we're 2/3 of the way there,
You're
so
almost
that's pretty
done.
good.
5 more
Breathe in and
letters.
out. Breathe in and out.
But again, she's got a lot of, she feels it more because she has a lot of pigment here. Okay, and those letters are pretty thick. A majority of tattoos we do are like, 1/5 the size of this, they're very, very small. And some of the pigments don't hurt as much when we go over them with
Yeah.
this instrument. They don't
The
take
body
up the
digests
light.
the ink, and the ink's gone
So-
away a little bit more.
Yep.
Okay.
It doesn't hurt
Yeah.
as bad.
Now,
so.
when this is all done in, say, in a week or 2, what will her skin look like? Obviously, we'll never go back to, will you see like an outline of this?
Yeah,
tattoo?
well, it's going to take, tattoos take a few treatments, and they can take up, believe it or not, they can take up to 12, 15 treatments to get rid of the pigment. We don't know yet because it's the first time we've done her. But you'll see, basically the tattoo will be here. Hopefully it'll be lighter. It may take 3 treatments or so to actually see the lightening, but that will happen. So, and then we're ready to go.
Yeah.
Now, I know when Ray was in here and he was actually setting the laser speed, does it, the stronger the laser that the patient can withstand, is that better?
Well, actually, with the speed, you can just go faster, and it's less discomfort for
Okay.
the individual getting it. Some people are more comfortable doing the faster speed. Some people would rather do the slower speed. But in this case, this actually is pretty rapid procedure that we're doing.
What about the intensity of the laser?
Well, you can actually set the
One
laser.
more letter.
Yeah, we're really almost there. So, you can actually adjust the intensity that you need. You can adjust for the actual color. So we might use a different frequency for a different color. And that's
right.
it. She did it.
Yay, you did
She
it.
did it. She's still breathing.
Just
I don't know if I'm breathing. Oh my goodness, I felt so bad.
Yeah, she did great. So
But you can see
really-
where you just finished doing the laser as opposed to the top portion where it's already, you can see that the skin is raised a little bit to form. It's probably going to crust, I would assume, right?
Some people can get some crusting, some people don't. And most people do perfectly fine with it. And like we say, if there's any crusting or opening, we tell people to definitely cover it. We can use ice immediately afterwards, which is relieve a lot of, or about all of the discomfort. And you can see it's a very, very simple procedure. So it just requires several treatments to get adequate clearance. But
How
she
you
was a
doing?
good patient.
Good.
See, it
You
was her
doing good?
first
Yeah.
treatment. She did tremendously.
Okay.
So-
Now, talking about from moving away from laser removal to a big night coming up here at the Dermatological Center. Here, we're located on Laurel Street, the medical complex in Hazleton, Pennsylvania. It's going to be a beauty night. You want to look younger. You want your skin to look fresher. Tell us
Right,
about
and
that night.
Well, actually, what we'll be doing through the company that sponsors it, we'll be giving reduced rates for a new Botox substitute called Xeomin. And there are a couple of fillers out there, Bellatero and Radius, that will be giving reduced rates, and they're used to get rid of creases here. And of course, the Xeomin is like Botox, and that's used
But I
to get
think
rid of creases here and those so-called crow's feet here. And again, the company was kind enough to sponsor it, and there will be reduced rates for all the treatments. And you'll be here. So
Yes, we're going to be
yeah,
here. We're going to
we'll
do a
be.
show. We're going to, Botox and fillers. I'm a big, big fan. I know a lot of people stop me and ask me about it because they've seen the show and they've seen great results. Again, if you take care of your skin, you stay out of the sun, you stay away from smoking, you drink a lot of water, these products can actually make you look 10, 15 years younger and actually help with decreasing the aging process, right?
Absolutely.
So who wants to look
Absolutely.
younger?
And I'm
Who
actually,
wants
I'm
nicer
only
skin?
25, but thanks to all the fillers and the
Oh,
Botox.
you're
look,
15,
yeah,
at
I look
least.
whatever.
21 again, right?
So they do work, actually.
All right, so you can call here for more information on the beauty night if you want to schedule an appointment, but we're going to be here. I'm definitely going to be here interviewing some people about it, and we're finding that more and more people in their 20s and their 30s, even their
Right.
40s, are getting these procedures done earlier, again, for maintenance purposes, and more people aren't afraid to say that they are getting some
Right.
of these.
It doesn't mean that certainly anybody who wants to be on TV can be on TV, but
Right.
obviously the majority of people there who
Right.
want to be on TV, well, that's fine, okay? But, if we can get one or two people just to demonstrate, I may have to get Jeannine to inject me if we run out
I
of
was just
people.
going to say, you read my
Yeah, I know,
mind.
she
I
would-
said, I'm going to be giving
she would
Doc
actually love
Botox.
to
He's
do
going
that.
to be giving me filler. I can't wait to put a needle
Yeah,
to your
so-
face. I will be
yeah.
very gentle.
I'm getting nervous already. But anyway, I'll be there, Jeannine will be there, and hopefully a lot of other people will be there too. And Katie will be here also.
Yes, and if you have any
So-
questions, again, I'm always able to, take your Facebook questions. My Facebook is Jeannine SSPTV. I'm more than happy to talk to you about any of the procedures we do here on Skin Sense, and Doc is always available with his staff here. You could call the front desk and ask any questions that you have about pricing, insurance, procedures. Everyone's very friendly, and they get the job done well, right?
Yep, absolutely.
All right, so thank you
Perfect.
for coming in. Again, we're talking about the laser treatment. If you want to get any of these procedures done, make sure that you check and you are in healthy shape to get any of these procedures done, correct?
Yeah, and really you don't have to be that great shape to get the procedures done, which is good because you've seen it's
Breathing body and we're good, we'll
they're
take
very
you.
very superficial, and some of them are painless, some of them have a little bit of pain associated with them, but they're very very easy to do. We usually do the lasers every 6 weeks or so. Now, getting back to tattoos, it doesn't pay to do the treatment earlier than 2 months because you really want the body to start working to get rid of those little tiny particles, which are microscopic in essence.
Okay.
But a lot of people want to have things done on a fast track. Well, don't do that because it's not going to do any good. So
Okay.
we tell people, wait 2 months or even 4 months between treatments.
All right. Again, if you have any questions, let me know either through the office or on my Facebook account. And you could check out the website and our website here on News 13 SSP TV. And I'm excited about the July show.
Should be fun.
Everyone
Should be a
likes
lot
that.
Of fun.
Everyone
Yeah,
wants to look
yeah.
younger, right?
And the company told me they're having refreshments. What they are, I don't know, but that's it's
Very
even
good.
better.
Very good.
Incentive, right?
Yeah.
All right.
yeah,
Well, thanks for joining us here on Skin Sense. We'll see you next time with the beautifying show here on SSP TV.